Good afternoon. Welcome and thank you for joining us this afternoon for our fourth virtual donor briefing. Many of you have joined us for other sessions and we're so glad that you're back. For those of you that are joining us for the first time, we're so pleased to have you on this webinar. We miss not seeing you in person, but are fortunate to have alternative ways to connect. As you know, each session has subject area experts sharing their knowledge. Each of these webinars, we want to be interactive, and I'll explain that in a minute. And we're really grateful for our speakers today who are working daily on the front lines. Christina will introduce them in a minute. Before we start the program, I wanted to encourage you to continue to do what we can do for our community. You have been so generous to date. Many of you have contributed to the COVID-19 Community Fund, which has raised more than $2.7 million to date. We're still actively looking for your support. More than half of the dollars have already been distributed to local nonprofits, and the remaining will go out the door in the next month or so. In addition, many of you have supported our local nonprofits directly or through the Great Give, where, as many of you know, we are proud to say that the amount raised this year was double of what was raised last year. So we're deeply appreciative of all that you are doing. Thank you so much for the many ways each of you make our community a place we are proud to call home. All right, a few housekeeping items. Thank you, Carmen, you were ahead of me. All participants are on mute during the presentation. If you have difficulties with the technology, please contact us in the chat box, which for most of you is on the lower part of your computer screen. And then as the presenters are talking and you have questions, please go to the Q&A box and type in your question. And Christina will facilitate that portion of the program, and we'll get to as many questions as our hour allows. So again, thank you for being with us this afternoon. And Christina, I'll turn it over to you.
Thank you, Dottie. And we are thrilled to have Dr. Suzanne Lagarde and Michael Taylor with us today. So I will make my comments brief so we can get to the main event. I just wanted to provide a quick update on some of what the foundation continues to learn and hear and understand about how this crisis is impacting the nonprofit sector. Many of you have been joining us over the last several weeks while we've been doing these donor briefings, and you've heard me talk about this before. Unfortunately, not much has changed. The same challenges exist. And you can see those challenges we have listed on the next two slides. I will say that while the state of the nonprofit sector is unstable and uncertain, it really is quite impressive to see how quickly and effectively many health, basic needs, and social service organizations have been able to transition to remote service delivery to provide health, basic needs, and social services. The pivot to focus on a COVID-19 response looks like it's gone surprisingly well, given the significant barriers that organizations have faced in making those transitions. The resiliency of the sector has also been impressive, given the devastating revenue losses that organizations are experiencing as a result of many reasons. Arts organizations are experiencing significant revenue losses. I want to call them out because today we're talking about health service organizations, and a lot of our COVID-19 response grant making has been primarily focused on basic needs and health serving organizations. But we do want to continue to acknowledge the struggles of the arts sector and individual artists, which we know the arts is a vital piece of our community, and many of our donors care very much about the arts organizations in this community. We've really seen an amazing response from nonprofit board members who are showing up like never before and supporting leaders and staff in new ways. We were actually pleased to learn in our current responsive grant making docket to learn that so many organizations have actually successfully been able to apply for the PPP loans through the SBA. We had heard organizations were having lots of challenges around that. And we were pleased to see that many have been able to overcome those challenges, in many cases with help from board members who are attorneys, bankers, and accountants. So we think that that outpouring of generosity and willingness to help has gone a long way. You can see on the slides, as I said before, we have kind of a laundry list of all of the challenges the nonprofits are facing. And you can see that there's a significant increase in demand for particularly basic needs. The disparate health issues, which we touched upon at the last time, we learned from Dr. Marcela Nunes-Smith on our last donor briefing that those disparities are significant, and we're hoping to learn more today from Suzanne Lagarde and Michael Taylor. We know that mental health and well-being continues to be an issue. The educational issues are overwhelming in terms of getting students, particularly students of color in the urban environment, access to Chromebooks, infrastructure, technology, and Wi-Fi, and the supplies they need to engage in distance learning. The percentages of students who've been unable to engage in distance learning have been significant, and it continues to be an issue. So with that said, I want to thank Michael and Suzanne again for making time for us today. We're grateful to have both of you together. And I want to thank you both for your leadership and work in responding to this pandemic. I'm going to start us off by asking a few questions, and then we'll take questions from the audience. We have many people on the call, so I'll do my best to get to your questions and as many questions as possible. And in our follow-up, we can try to address some of the things that maybe we don't get to during this call. As Daddy has instructed, please use the Q&A feature to submit your questions. So to start, I'm going to ask each of you to take about 5 minutes to briefly summarize for us how your organization has responded to the COVID-19 pandemic. Maybe Susan, you can go first.
Thanks, Christina. I have to say, when you told me that we would have 5 minutes to answer this question, I'm like, oh my God, how am I going to do that in 5 minutes? But I'm going to try. So as I think about it, it really divides into two categories, sort of the short-term acute, when this all hit and the governor started to shut down the state, to where we are today, which, although it's barely 3 months later, a lot is different. In the short term, we literally, as a healthcare delivery system, had to convert overnight to telemedicine. Although this is something that's been in the healthcare world for many years, decades, in fact, it is not common in Connecticut mainly because our Medicaid, the state of Connecticut, has never reimbursed for telemedicine. Well, that changed overnight, and overnight we had to identify a platform, instruct nearly 50 clinicians on its use, not to mention their support staff, which number in close to double that, close to 100 nurses, medical assistants, behavioral health providers. We had to educate patients, and we had to ensure that we had a robust broadband structure and robust security. So that was number one. Number two is we had to get people to work from home. Currently, a full third to 40% of our 215 staff now work from home and have been working from home for several months. What did that mean? We didn't have the infrastructure. We didn't have the computers. We purchased over 40 computers literally overnight. Those computers, those laptops had to be configured by our IT staff of 3 individuals. And then we had to get folks instructed on them and into their homes. One area of great concern to us that we had to work particularly hard on was our call center. We wanted to get our call center also to work from home. Initially, they worked in a very tight space. As the billing department moved out, we spread them out, but we still felt that they would be better off in their home environment. Our vendor initially said, not possible, your technology is too old. I want to point out that our technology was only 5 years old, but nevertheless, they said it was not a possibility. However, thanks to the ingenuity and the creativity of our IT staff, we managed to get them home. And today our entire call center, in fact, for the past month, our entire call center has been working from home with incredibly impressive call metrics in terms of, small numbers of dropped calls, good service levels, et cetera. And then layoffs. I think we need to address this. You know, there suddenly became several sectors of our population, our staff, that really had no more job. Our whole dental department literally came to a snail's pace where they were doing only emergency cases. So we had to, despite our attempts to not lay off people, not to furlough staff, in the end, we ended up furloughing either fully or part-time 27 staff. But I can tell you that as of today, 22 of those are either back at work or have decided for a variety of reasons that either they're going to retire, that they're not returning to work. And we still have 5 out there, 5 staff who we're hoping to return, but 3 of them are in our dental department and 2 are in our school-based health centers. So those are the challenges there. And like everybody else, PPE initially was a huge problem and a huge concern. We were paying, you know, triple prices to try to get things sometimes of dubious quality. I'm happy to say that because of a lot of efforts of a lot of people, that has significantly improved. Those are what I would refer to as sort of the short-term, you know, bang issues that we had to deal with very quickly. Those things have sort of settled down to some sense of, I don't want to use the term normalcy, but to some sort of routine. The longer term had to do with how do we deal with COVID? How do we deal with a community that is predominantly minority, low income, many of whom are living in households where 5, 6, 7 adults are living in very cramped quarters, yet who have to go to work if their work continued because they're in service area sectors. So I'm going to highlight 3 of the main areas that I feel particularly very proud about. The first is about a month ago, we established a walk-in clinic for testing. So many of you know, testing has been hard to come by, particularly in communities such as ours. It became clear that virtually every testing center in the state was drive up, and we know that a significant percentage of our patients don't have cars or have transportation barriers. So we decided to create a walk-in clinic whereby we asked anybody who wanted, doesn't have to be one of our patients, we had a dedicated phone number, 203-871-4179. We asked that people call first so that we didn't have a bunch of people congregating. I can tell you that the demand was profound. We started out with capacity for 24. We within 2 days doubled that to 48, and then within 3 days added a 6th day. We initially were doing it Monday through Friday. Now we ended up doing it Monday through Saturday. That demand continues, and we're averaging about between 250 and 300 tests weekly. The other area that I want to highlight is food. We know that food was even before COVID a problem in our community. Food insecurity. We participated with the Connecticut Food Bank and Junta for Progressive Action on a monthly, the 3rd Saturday of every month. We held a mobile food pantry at the parking lot of our local school. The last time we held it in February, we had nearly 300 families show up. We knew in March that we could not congregate that sort of group. So on the weekend, our staff came in on their own time. We packaged food for 160 families, and then our staff went out and delivered it to the 160 families, ringing doorbells and leaving it on their porch or what have you. Since then, we have partnered with M7, the cab company, who are also struggling in this climate, and we are using some funding that we've received from our community and from other sources. And we are, I can just tell you that this past Saturday for May, we did it in April with M7. We did it again just this past Saturday. We brought food to 197 families, distributed through M7. And then the other piece that we just started up is a partnership with some of our local food retailers, so Ferraro's Food Market and Seatown, and anyone who is testing positive, who is a resident of Fairhaven and meets certain criteria, they receive food from that we put together, the healthy food, produce, vegetables, some meat products, dairy products, and they're delivered to their homes, again, in partnership with M7. And then last but not least, everybody's heard about the crises in our nursing homes that so much of COVID that we're seeing, and the suffering and the deaths are coming in nursing homes, not through necessarily any fault of their own, but just the nature of who they serve and how they serve. So we, in an attempt to help, we partnered with Mary Wade, which is a nursing home in Fairhaven, and our staff went in there and in one day tested all the residents and all the staff and got the results back in 24 hours. And that enabled Mary Wade to then successfully cohort patients so that residents are with positive staff and so forth. And we're continuing to do that on a weekly basis to go back and retest the staff. And we are doing a similar thing with Masonic Care in Wallingford next week. So those are three of the areas that I want to highlight that we're doing that didn't exist pre-COVID. And with that, I will be quiet. And I probably took more than 5 minutes, so I apologize.
That was great, Sue. It was perfect. Thank you. And I have plenty of detailed questions to ask you and Michael once we do the overview. Michael, do you want to give us a brief summary of how your organization has responded?
Impossible to do so in 5 minutes, but I'll give it a shot. So the first thing I want to do is thank the foundation community for the incredible support that you continue to provide our health center. It really has made an extraordinary difference in our ability to attempt to rise to this challenge, which I think everyone agreed with is unprecedented. So a heartfelt thank you to everyone who's viewing this. What I'm going to describe, I think in many respects mirrors what Suzanne shared. We needed to make a rather extraordinary shift and did so in a matter of, I'd say 10 to 12 days. The pandemic hit at about the third week of March. Almost instantaneously, our face-to-face visit encounter dropped by 50%. The 50% we lost is the 50% on which we earn revenue to sustain this organization. So it became crystal clear immediately that we needed to adjust very quickly. So with that, we consolidated operations to 5 locations. We had no choice with the school closed to shutter our school-based health center operations. As Sue indicated earlier, our dental departments were shrunken to only accommodate urgent visits. We curtailed a lot of extended hours that historically we had offered here. We immediately had to train our staff as to testing for COVID, and probably started offering COVID testing from the very outset, did so very quietly at our main care site. But that was later expanded to our operating a full-time testing center at our Dixwell location. We were fortunate that we had a fair inventory of PPE, protective equipment, but that needed to be bolstered, so we were quickly moving in that direction. And I would echo Sue's thanks to the many organizations that will partner with us to improve our access to PPE. We needed to pivot to, and pivoted to the provision of telehealth services instantaneously. So we had to test technology to do that. Fortunately, we had some experience because we had been experimenting with telehealth for at least a couple of years. So we had some experience to rely on, but having to make that shift for 200 providers and all their support staff as quickly as we did was one daunting task. All of the relationships that we had built historically with the Connecticut Food Bank, where we've been working with them for years to address food insecurity, became critically important to sustaining people in this extraordinary time. We too, with the curtailing and temporary discontinue of operations, had no choice but to temporarily furlough. I think for us, it was about 100 staff members. We have been continually bringing those staff members back as our visit volume from telehealth and telephonic consultations increase. And I think right now we have brought back at least about half of those people. It was a very quick shift. The number of things that we're involved in these days include partnerships with Elm City communities to ensure that residents of Elm City community developments maintain engaged in care. Certainly doing all we can to try to address people's food insecurities. Of great concern to me is reminding all the parents within earshot of how critically important it is that even during these rather frightening times that they continue to bring their children in for vaccinations and well child visits. Because people in their concern and their fears around COVID, please remember that your kids need those well child visits and vaccinations to maintain their health. So that's it in broad sweeps.
Thank you both. We know this current crisis is not only shining a light on the existing racial and ethnic health disparities, it's making those disparities and the potential for their long-term impact much worse. At our last briefing, we heard from Dr. Marcela Nunez-Smith about the troubling racial and ethnic health disparities as it relates to COVID-19, particularly in the neighborhoods served by your two organizations, which I know is no surprise to the two of you. We looked at some data and the heat maps and heard about some examples. Can each of you tell us about what these disparities look like on the front line and what some of the biggest challenges are related to that? Maybe Michael, you could start this time.
Sure. What those disparities mean for the minority communities that we serve is extraordinary fear. And so it is the reason that we made the decision same time as Fairhaven about a month ago to establish a testing center at our Dixwell location in the heart of the Dixwell Newhallville community to make sure that the largely minority residents of those communities have immediate access to testing resources, but that is done so in a complementary way to the primary care service, primary care, medical, behavioral health, and dental services that we also offer those residents. Our credibility in those communities has been particularly important to engaging people and getting them to come out from hibernation to be tested even when they're symptomatic. So we are very appreciative that we have gained the trust of residents of those communities so that they come out and be tested.
Sue?
I think to date, we are approaching testing just about 2,000 people.
Wow.
So similar to Michael, I can tell you the demographics of the cases, the positive cases who we report obviously to DPH and to the departments of health in their respective towns of residence is very, very close. I don't have the exact statistics. I was trying to get them before, but I didn't get them precisely. But since I see them every week, I can tell you that virtually 95 to 98% of them are Hispanic. Now, obviously, the community we serve at Fairhaven is largely Hispanic, so that in and of itself is not surprising. But the percentage that are COVID positive are higher than our general population. So we know that, and it's not surprising in that our staff, our patients live in small, close units. So it's very hard to isolate when somebody is diagnosed as being positive. One interesting statistic that I want to share is that when we opened our walk-in clinic about a month ago, we started to follow a lot of different demographics. And one of the demographics we have followed is a payer source. Even though patients are not charged, dependent whether they're insured, uninsured, no one is charged for the service. But a full 60% of the roughly 1,300 patients that we have tested are what we call self-pay or uninsured. And in our community, uninsured is virtually synonymous with undocumented. So I look at that in a positive light, in that similar to what Michael just said, they are trusting enough to come to us to be tested. I mean, you know, a lot of the drive-through clinics require proof of, state residency. And although a simple driver's license might be able to provide that, I think a lot of the patients we serve look at that with fear. So I'm pleased that they are trusting us enough to come and be tested, because we need to test everybody, because we're all in this together. If we don't know everybody who's positive and how to help them, everybady's at risk as a result of that.
So you both mentioned testing in your response, and we hear a lot in the news about the importance of testing and tracing. And I think we know what testing is, but can you describe for us what is actually meant by tracing and what that entails? Sue, can you go first?
Sure. So first of all, I want to say that we are not doing that. We are not doing the tracing portion of that at this point. I know in New Haven, the Department of Health under Director Bond is working very hard to set up that system. But basically what tracing is somebody who is diagnosed as being positive, in this instance for COVID. Somebody will go to that person and ascertain all of that person's significant contacts during the period of presumed infectivity, and then go and find those people, and for those with significant exposure histories, attempt to get them to isolate until a period of potential infectivity has passed.
So I would add, for those of you who might have been around during the AIDS epidemic years ago, the tracing mechanism is the same, figuring out who that person had contact with and might have infected and intervening.
Thank you. So while we're talking about racial and ethnic disparities, I also wanted to ask you about the differences in terms of gender and the differences in terms of impact on gender. I've read that men, particularly Black men, are more at risk for being hospitalized and having the worst possible outcome if they're infected with COVID-19. And then we know that many of the frontline healthcare workers are women, which presents a different kind of risk. And I'm wondering if you can talk a little bit about the impact on gender and the differences you're seeing there. Maybe Sue, you could start.
So sure, I think I have the same data that you have, Christina, that certainly men, perhaps if you look at the state data, perhaps there's a slightly increased risk in the male amongst men, but that outcomes are worse. Speaking for an organization that has a predominant female population, I can tell you that I'll give you our statistics. So early on, at Fairhaven, we had 15 out of about 200 staff who tested positive. Initially, that was a very, and this is not really talking so much to the gender thing, but I think it's a topic that merits discussion, because it spoke very much to the fear that everybody had in many times of the unknown. I'm very proud that with working with our staff, using our behavioral health team to instruct them and teach them on different techniques, mindfulness techniques, meeting with the staff. We meet weekly as an entire organization through Zoom. We have these huge Zoom gatherings every Wednesday morning. And I think some with just the passage of time and their ability to see that their colleagues who were out with COVID in many instances are now back at work and are doing well, has helped to alleviate some of that initial fear, which was one of the big challenges we had to deal with early on. So not totally addressing your question about gender other than the statistics. I do think it's worth commenting on the, cases of COVID in our own staff, in our own family, and the impact of that on staff morale and fear. And I think are factors that are worth commenting on.
Thank you, Sue. Michael, do you want to say a word about the differences in gender impact?
Sure. I'll speak specifically to males first, and then even more specifically to the historical care-seeking habits of Black males, which are not good. We quite typically don't go to see a provider until we are urgently or emergently ill. And with that, with many of us having social determinants of health associated with poverty and so forth, and poor diets, that's a bad combination to have, especially in the midst of a pandemic. As it pertains to women, many of whom might as well suffer from social determinants of health, might be in low-paying jobs, not live in the most ideal living circumstances, continually exposed to a virus. It can lead to higher incidence rates for those individuals, and as well poor outcomes. So unfortunately, very unfortunately, what we're seeing in terms of disproportionality with certainly Black males and minority males and females of low income status is not at all surprising.
Thank you. Sue, you had started to talk about, give examples of some of the things that you're doing for your staff and about the well-being of your staff. I'm wondering if you both could talk more about your staff, not just the well-being of your staff and the health of your staff, which is important, but there were questions from some in the audience about how you're handling staffing, recruitment, and scheduling as you move forward into the next 12 to 18 months. Michael, do you want to start with that?
Sure. So one word about our staff is amazing. Their dedication to the welfare of our patients is nothing short of astounding. They really are heroes. They really have maintained healthcare for people during this pandemic and been on the front lines, much with a great risk to them and their family members. But they continue to come, and I think it speaks to their commitment to what we do, to the mission of our organization, and the commitment we have to the people we serve. We are concerned, continually concerned about not only the impact on our staff of this situation we find ourselves in, but as well on our patients. Everyone is isolated now. We are gravely concerned about the impact that has on people's mental state, because we are by nature social beings. And when isolated, what we found is that people's underlying mental health issues can surface very readily. So we are very fortunate that, as well as a primary care medical provider, we're also a significant provider of behavioral health services. We have more than 200 staff members who are devoted to the provision of behavioral health services. And so we've used those internal bench strength and resources to ensure that our staff remain emotionally well to deal with this very, very challenging situation.
Sue, did you want to add anything else to that?
Just to echo, I mean, that I am in awe of our staff. I'll give you an example. We followed the guidelines that are put out by the CDC, similarly by Yale New Haven Hospital, about age risk stratification for staff, one of which is age. And we put a cutoff on patient-facing activities at an age of 65. So any provider who is 65 or older was told they had to do only telemedicine. They could not see patients face. And we had several who literally begged us, who gave us sheets of paper with absolving us of any legal responsibility because they did not want to give up that aspect of their practice. We had staff who are employed, nursing staff who are literally employed on grants, who came and said, I'm not working on my grant, I'll do it for nothing. I want to be on the front line. I want to take care of people. So I cannot tell you how much the staff really rose to the occasion. I mean, when we went into Mary Wade and we're testing literally in full PPE, some very sick, sometimes combative residents, we had more volunteers than we could accommodate who wanted to do that. So again, I just want to re-emphasize what Michael said, that these folks are unsung heroes, and they certainly have my I am so proud to be able to say that I, work with them and for them.
Thank you. I think it goes without saying that we are all in awe of the two of you and your staff working on the front lines. The response has really been amazing, and I think the trust and the credibility of your two organizations has really made a huge difference in this community's ability to respond to this crisis in an effective way. You both have talked a lot about the concerns you have, many concerns you have. Can you each say a little bit about what maybe has surprised you in all of this? Sue?
What has surprised me? I don't know. I think every day something surprises me. I never know what's going to surprise me next. I should have, so I guess one of the things I would say is, I think what we can all agree that perhaps the federal government has not, whatever your political persuasion, that perhaps there is some basis for saying that maybe they have not done what they should have done in terms of preparation for this. But I do have to say that in terms of supporting community health centers, our federal government has really has really come to the fore with funding, with educational support, with changes to a lot of regulations that are appropriate and under different circumstances, but which under the current circumstances sort of slow us down. So, example, waiving of certain procurement procedures, just to get something like a negative pressure room built in our facilities. So that has surprised me, but in a very positive way. And I'm interested to hear what Michael has to say, what surprised him.
It wasn't necessarily a surprise, but really a confirmation that goes back to my earlier comment of how extraordinarily committed our staff are to what we do. It's not a surprise, but it's one wonderful confirmation of how truly empathetic and sympathetic the human spirit is.
And if I can just jump in, Christina, even though the other thing that surprised me, but literally led me to tears on more than one occasion, was the support of the community. So we have received grants or funds from local, I'll give you an example, the Chatham Square Neighborhood, right, Association. I suspect gave the three organizations in Fairhaven, us, Junta, and Mary Wade, they gave us each $2,000 to do whatever we needed to do. In my mind, that was probably their entire budget, yet it was emblematic of how much they value their partners in the community. A similar thing happened with the district management team. As you know, New Haven is divided into 10 districts. We're the Fairhaven district. Just before COVID, they had received a $20,000, as every district had received a $20,000 sort of grant, if you will, to sort of do what they wanted in their neighborhood. And at least in Fairhaven, this was a big deal. They had solicited proposals. I think we got 12 proposals. Voting took place. And then literally before they made the awarding of these dollars, COVID hit. And the district management team voted and made the decision to split it in half, take half of it and give it to those who had been voted the top recipients amongst the proposals that had been put forth, and then took the other $10,000 and again divided it amongst the three main health partners in the community, and said, we know you'll use it wisely. Do with it as you need. And in some senses, you may say, well, those were small amounts of money, but those were dollars that were so valued and so special to me. Literally, I was incredibly touched by those acts of generosity at this time. And, and it really reinforced to me the importance that our organization held in our community and the value of community, which is amazing.
Yeah, I think we definitely share in your observation that the community's response has been extraordinary, and the generosity has been overwhelming. And it's really been, it's been one positive thing in all of this, to see how the community has come together and to see how people have rallied to support organizations like yours. I know that we have Will Ginsberg on the line, who is our CEO, and I think he has a comment or a question. Are you there, Will?
I am, thank you. And can you hear me?
Hello,
Yep.
Will.
Michael, Sue, hi.
Hi.
So first of all, thank you both for doing this, and thank everyone who's on the webinar for being with us. But more importantly, I wanna chime in right here, because as we talk about the extraordinary contributions that your institutions are making, that your staff, your respective staff members are making, this is a moment when I, first of all, wanted to say thank you to you both and to everyone associated with Fairhaven Community Healthcare and with the Cornell Scott Hill Health Center. And I hope you will pass along those thanks from the Community Foundation. And I have to say, it gives me, you know, I take a longer term view here. I think this has become, as I've gotten long in the tooth, this has become one of my designated roles in the community, perhaps. But, you know, I think about the extraordinary history of these two institutions and how they have been built, yes, with lots of federal money as federally qualified health centers, but with deep commitment from this community going back plus or minus a half century. I think of Cornell Scott, I think of Katrina Clark, I think of the ways in which, and you two as their extraordinary successors, the ways in which this community created and has supported these two institutions, which have provided indispensable services every day for close to half a century. But here we are in the spring of 2020, in the worst public health crisis of our lifetimes. And we have these two institutions because of the great leadership that you two have provided and your predecessors, and because of the way this community, way beyond the Community Foundation. I mean, we ourselves have a long record of which we are very proud of supporting the two of you, but way beyond the Community Foundation. These have been these two institutions represent in many ways the best of our community. And it proves yet again, maybe more clearly than almost anything else could, how you have to invest in building these institutions. So when the you-know-what hits the fan, that we're ready to respond as a community and serve the people who need us the most. And that's exactly what's happened in the midst of this terrible pandemic with Cornell Scott Hill Health Center and with Fairhaven Community Health. So that's my long-term perspective on this, and my deep gratitude to you both and everyone you work with.
Thank you, Will.
Thank you. I will certainly make a point of passing that on. As I have said on occasions in the past, one never enters this line of work because you expect accolades, but they're wonderful on the rare occasions that they happen. So thank you.
So if I can follow up with a question, and then I'll go back to being a face in the crowd. So one of the things that has been most, again, extraordinary and unprecedented about COVID-19 has been the scale of the governmental response, the federal response in particular. If not unprecedented, at least we haven't seen anything on this scale for a community like ours since the Great Society more than half a century ago. So how is that, and a lot of it, of course, is devoted to health issues, although perhaps not enough, but how is that, what does that look like from your seats in terms of federal support for federally qualified health centers and in other ways that can come back to support you all and benefit your institutions and the services you're providing?
So if I may, so I was very surprised at how quickly the federal government responded in terms of providing needed funding to better enable us to address issues around COVID, and also to sustain our organizations. Very surprised and appreciative. There are certainly some shortcomings of that, and I'll give you one. Much has been made of the payment protections that have been afforded to a lot of nonprofits to enable payroll continuation. That was not made available to the Cornell Scott Hill Health Center because while we suffer and are the victims of many of the impacts of COVID, we are a larger organization and employed 500 people. So we were simply ineligible for the payroll protection program. That sort of left us in a situation of having to fend for ourselves and was largely the reason why we needed to move as quickly as I indicated at the outset of this gathering to make very quick decisions and act within literally 10 to 12 days.
Right.
And I'll echo Michael's comments. We were fortunate enough to be able to participate in the PPP, but where we're finding the challenges on the federal level has to do with our undocumented population. So many of you have heard that the federal government has made statements that if you're uninsured, the government will pay for your care, for your testing. We have opted at Fairhaven not to participate in that program because they are requiring a lot of information, including data such as social security numbers of any claim that we submit. Although the government has clearly not mentioned whether they are covering uninsured Americans or all uninsured. They've not made that distinction. The fact that they are requesting that sort of information, we feel that we cannot share that because virtually all of our uninsured patients are uninsured because they are uninsurable because of their immigration status. So we felt that it would be, we've been informed that the program is being administered through Optum. You have the opportunity to put in one claim, and if they deny it, it's not like your typical business. It's denied. You can't request a reevaluation. Most of our patients will not have social security numbers associated with it, and in some way we are concerned that if nothing else, the perception of our patients that we're giving this information to the government would undermine that trust that we've all talked about so favorably in this session. So this is going to be a huge hit for us financially because right now we have no means for payment. Similarly, the state has said that they would cover that. But again, the only way they cover it is that the individual has to go in through Access Health CT, go through a very complicated, lengthy process of applying for Medicaid and then being denied so that it can then be given emergency Medicaid. And given the skepticism that many of our patients have with anything of that nature, it's not going to happen, and we don't feel comfortable trying to push them to do it. So one of the big federal issues for us right now is this whole issue of coverage for uninsured, which for Fairhaven is about a quarter of our population and is based on our testing is 60% of those who are coming in for testing. We don't have a revenue stream for that particular service at this point in time.
So what Sue has spoken to is just one of the strings that are associated with receiving federal funds. There are no such thing as federal funds that come to us without a lot of requirements, restrictions, and strings. And I've already been informed the audits will be intense and many.
So to that point, Michael, we know at the foundation that general operating support and flexible funding is really what most nonprofits need most right now to help them work and continue to work on addressing this pandemic. Outside of general operating support, because people want to know what they can do to help, where is the biggest unmet need or gap, and what can people do to be helpful?
I'm going to ask that the public really be mindful that while we're in the midst of this pandemic, that maintaining their health is the most important thing that they can do for themselves and their family members. And so they should not ignore their own healthcare needs. I'm thinking very particularly in this instance about the many parents whose children need to be brought in for well child visits and vaccinations, and appealing to those parents to make sure that those kids, that those visits happen and those vaccination happens for kids. I'm appealing to the seniors who are more isolated now than ever before, who might live in congregate care facilities, whose neighbors represented their social network, who had previously been very active and now they're isolated, and depression can set in and really have a debilitating impact on them. I really want to remind people that while we're in a precarious situation now, that they make an extraordinary effort to protect their own health. And that's both their physical health and their mental health.
Thank you, Michael. Sue?
So again, I just want to go back to the issue, which is always a big issue for Fairhaven, that is our uninsured population, and which is synonymous, virtually synonymous with our undocumented population. This is a time for them of great fear for so many reasons, right? They are, getting hit hard, as your statistics reveal. They are either without jobs, without food, or they are in fear of losing their jobs. And then for us as the organization who wants to care for them, we really have no clear revenue stream. We're doing it, and we're doing it, and we're doing it gladly, and we are doing it with open arms, and we want them to come. We want them to be tested. We want to care for them. But my anxiety is, depending on the length of this pandemic and whether we have another surge in the fall, that is going to be an issue for us financially.
I have one more that really, really concerns me.
Go ahead.
And that is the extraordinary number of people who thus far have applied for unemployment insurance and who are probably within a matter of months potentially being uninsured, having no health insurance coverage, or being new Medicaid recipients. And so what does their healthcare future look like? Where will they go for care? And whether we as FQHCs have the capacity currently to absorb as many as 50% increased patient growth. That's really daunting for me.
Thank you. These are, of course, very heavy topics and very trying times we are all in. And I can't imagine what it must be like on the front lines for you both and your staff. We try to end these sessions on a more hopeful note. So I'm wondering if you can each say a little bit about what gives you hope. I know one thing that gives me hope is knowing that the two of you are leading our two federally qualified healthcare organizations, and you have, as you've both said, an extraordinary staff. Michael, do you want to go first and tell us what gives you hope?
It is exactly that gives me hope. It is the extraordinary people who are the Cornell Scott Hill Health Center, and people's innate ability and survival instincts. What I'm very confident about is that we care extraordinarily for the people who are New Haven. That will not change. In fact, it will become more intense as people are greatly challenged. And so people's human instincts and ability to care for one another always always inspire me and give me hope. And regardless of the challenge, I am 100% convinced that we will figure out how to make this work to the best interests of the people who we care so much about.
Thank you so much, Michael. What about you, Susan? What gives you hope?
So I have to echo everything that Michael just said. Our staff have been amazing. I want to, beyond the staff, again, what I commented upon about our community. I mean, it took a pandemic for me personally to realize the tremendous support we have and the true humanity of the people in our neighborhood down the block. It's been profound. It's been humbling. It's been very impressive. And then taking it on to a state level, I think one of the things, you know, when we have new staff come on board, one of the things I always do is I want to meet with them. And I like to tell them a little bit about the history of federally qualified health centers, because a lot of people don't really understand that or have a knowledge of that. And knowing that we started about 52 years ago, I mean, I'll just give a sort of a pause. It was in the Johnson administration that federally qualified health centers came into being. In that same administration, Medicaid and Medicare came into being. I mean, think of that and translate it into the environment that we are in today. It's actually truly astounding. But health centers have been around for now 52 years. There are roughly 1,400 of us in the country. And in the last calendar year, collectively, we cared for over 29 million individuals. I have enough faith in this country and in its citizens and in all of us to believe that we health centers, not me and Michael, but the health center movement will continue to survive because of who we are, who we serve. We are truly the safety net for this country. So no matter what obstacles I face, I am confident that the organization in some shape or form will continue to survive and will continue to live up to the mission of caring for a community that is truly remarkable. So those are my 2 cents.
Thank you. And thank you both again for making the time for us today. We know how extraordinarily busy you are. And to have you both together at the same time, I feel like was a miracle. I'm going to pass it off to Dottie now, who's going to close us out. Dottie?
I'd like to add my thanks and appreciation for your time, for your service, and for sharing with us today. And thanks, Christina. Michael, you alluded to the mental health challenges and that we're social beings, and this isolation is affecting us all. So our next webinar actually is going to be early in June, and we'll be sending everyone invitation shortly, and it will be around issues around mental health. So please join us. So thank you for your comments. We value your feedback, and if you can take a few minutes at the end of the session and there's a brief evaluation, we'd appreciate it. And again, thanks for joining us today, and I hope everyone has a safe and happy Memorial weekend. Thank you.